transforming acute care, impacting lives, justice for millions. So, impacting lives was my driving force, and transforming emergency heart care again. This acute emergency care for a critical care problem can happen to anybody, anywhere, anytime, whichever place or whichever place of the world they are in. So, I've created a journey where which this contentment has driven me to Gujarat, and I feel really content being over here in this state, and like to take it to a larger level from this state, and you never know what's there for tomorrow. Well, reaching out to all class, needy and the last mile health. This has these powerful image, this powerful phrase is self, you can read out, the last mile health. I mean, I'm sure everybody, have gone through a lot of health education during this COVID. But last mile health, we all talk about, primary healthcare, secondary healthcare, metro city, smaller town. What about last mile? What about this person who's over here? I mean, there can be millions. What about their health? And more than 60% of the population of India, rather, is in the villages, is in the tier 4, tier 3 cities, or even further down. In Bihar, in UP, in Jharkhand, in rural West Bengal, in rural Saurashtra as well. I'm sure nobody talks about them. Nobody talks about their health. Nobody is bothered. So this has inspired me because I have lost my brother who was in a village like this. Me being an entrepreneur, I started my life as a physician, then my fellow colleagues, physicians, becoming healthcare leaders, startups, hospitals, blah, doing very good. I mean, big empires being created like Manipal, HCG, they all were my colleagues down south in Bangalore. Then I've fallen into that stream of entrepreneurship as well. I started a couple of hospitals, getting again into the corporate world of M&As, blah, blah, blah. Has completely changed my life from being a cardiologist to a physician. I'm not from a well-off family. My patients supported me for my postgraduate exams. My parents did whatever best they could do. Suddenly got the opportunity to become an entrepreneur, met few investors, started hospitals. Suddenly, there's a family disaster. My brother, who was in a village, lost his life of a heart attack. By the time me and my younger brother, who are doctors as well, we could arrive, he was no more. So that inspired me. Where am I? I'm in the journey of a hospital business. I'm doing, starting multiple heart projects, hospitals in down south. Where am I? What am I doing? That had killed my family. That had killed my, the backbone of the entire family. The only bread earner during that phase for the entire family. What happened? He was in the village. Nobody's there to diagnose him of a chest pain. There's no devices. There's no doctor. There's no medicines. By the time you could reach a hospital, he was overdiagnosed. He was bleeding in his brain. And I saw him dead in my arms, in the ambulance. I said, where we failed? Doctor family, we failed. But this is the gap. I had 7, 8 hospitals, heart hospitals in India, right from Gujarat, Rajasthan, Kanpur, Assam. Yes, the journey of being an entrepreneur, a cardiacpreneur. But during that phase, this hit us very badly. So I had cut down all my hospital projects. Let in Gujarat. Then in one of the conferences where I met a couple of friends who are techies, I said, Doc, let's collaborate. Let's do something innovative. I'm not a techie. I'm not a coder or a software developer. No. So I collaborated with a couple of guys, couple of medtech guys. Let's do some pilot study. So we did this in Bihar. We did this in Gujarat. We did this with 5 clinics in Bihar and 5 clinics in Rajkot. So I'm here for a purpose, reaching out there in the grass root where the real agricultural farmings are there. There are primary health centers, community healthcare centers, But what about there are populations who are at least 5-7 kilometers beyond the PHCs and the CHCs, around a problem, influenced by a perspective. So this pictures are pretty, innovating by itself. I said, Doc, why can't, my team said, Doc, why can't we do this? I said, yeah, I do it. So coming back, as I lost my brother, I felt like, what are the challenges? I mean, like neglect of the rural population, access to healthcare. What about a population of maybe 500 or even 1,000? Somebody has a heart attack. He has to travel down 7-8 kilometers, walking or by whatever means. By the time he reaches, he might lose some portion of his heart. What about them? Because I lost somebody very close to me, my own brother. And I mean, all knows about neglect of rural population, emphasis on culture method, inequalities, shortage of medical person, expensive healthcare. Cardiology is an expensive affair. We all know about it. Problem statements. How this problem statement we worked out. Hot hospitals in small tier 2, tier 3 cities. I started heart hospitals. What about further down, last mile heart hospitals? How do we get people there, diagnosed? So we collaborated, got this industry-driven technology like smartphones, healthcare-driven technologies, medical devices, collaborated together to form a digital health ecosystem. I started this with the 10 villages. And now we have created this rural heart infrastructure, all digitally connected. A patient is monitored from a village, reaches in time, whereas I know his heart status that moment, the time he is diagnosed. You can see this rural. We started one of the clinics in a village in Amreli district with one of our mentors as well in his own village. Doc, let's start a clinic over here. This is a clinic in a hut, a chopra. Population of hardly 1,500. Guess what? 5 patients we could diagnose within a month of an emergency heart problem. A Ranpur to the nearest GP or a physician is about half an hour's drive down. What happens in that half an hour? We empower these clinics with medical devices. I'm as a doctor, I'm available there. At least I can give him some medicines to prevent the progression of a heart attack in that early phase. How do I detect? There are medical devices. There are, medtech software solutions to kind of integrate. So using all these, we could come out with a digital clinic box where I kind of diagnose now. Apart from heart, neurological problems as well. Apart from heart, now mental problems as well. We can probably look in. So multiple domains of approaches in healthcare. I can really get into these, and I employ a local village over there, a woman or a person who can easily use a smartphone. Just integration of the smartphone, and then taking it. But this 5 patient of saving that has given me the content, and hardly much of investments. It is just that the leadership, the content should be there, the intent should be there to reach out. I went to all the business school, I went even Harvard. I said, what am I doing in a village? You come out from America or from Europe? No. I did my education from Europe as well. But this is the content which I've been searching for. And I have built, numbers. I mean, each patient, I kind of counsel them, at least the patient reaches the hospital, we intervene in the right time. That is where I feel, yes, there is, Sir said, karma. I feel, yes, that is giving me that happiness. So that is where justice is getting delivered. So, a small village in Kodwa. We started this ECG digital program over there, medical cardiology, cardiology. So we did a small camp to educate people how to use this machine. How, we collaborated with local GPs who can't even read an ECG. We educate them. There's an AI tool which makes them know, yes, there's a doctor in your palm, in your handheld device. We've named this project as Swaraj Dharkan. So, I wanted to, so this is my command center, rural digital health, saving as many lives on a digital innovation. this command center is hardly in a 50 square feet of space. There's a large computer, and there's a physician. Whenever there's an alarm comes in because there's an acute emergency of a patient, which multiple ECG centers are there, there's an AI which filters the normal ones. The abnormal ones comes to me, and we do a telemedicine conferencing, and my clinicians do diagnose and give them certain medicines. I provide medicines as well in these clinics, completely free of cost, non-profit. But at least in doing so, I'm doing some justice, at least giving some time to these people to at least reach out to the nearest heart hospital. So more than 50,000 patients have been consulted. More than 100 villages are covered. 40 plus heart clinics are in pipeline. I've just signed a JV with Philips. We are going to, and BPL rather, we're going to start 100 clinics in Rajkot and in suburbs of Rajkot on using their, FDA-approved medical devices, where they would come in our foundation and try to, do a larger, impactful journey along with us. So, this couple of stories where, we could, from Jamkundra, a village, and Kamlesh Bhai, a patient working in his farm, suddenly got a chest pain. He went to a GP. The GP said, yes, he had the device. He could take an ECG, connect with me, and I said, sir, please give this medicine, send me home. Send us to the nearest heart hospital. Patient came, there was a major block, and we could intervene him. Imagine this technology or this application wouldn't have been there. Even if these devices are there, what about the doctors? What about post-diagnosis? What happens to the patient? Is the patient really going to get the treatment? So we have made a center of excellence where the primary healthcare, the last mile cardiology is, acute heart attacks are getting diagnosed, and we ensure that the patient reaches the nearest heart hospital so that the dots are completed. Then only, I diagnose, I advise, and I get the patient in and we treat them. That's how, we could really map those. And I'm proud to say, more than 100 patients we could interview in the golden hours, and we could do justice to them. We never know. These 100 patients would have, nobody could have seen them. And imagine, there are families behind them. So, as I lost my brother, I could see, my bhabhi becoming, so, depressed and lost. There can be many families, especially in rural India. I mean, how, families in rural India gets shattered when there is a loss in their family. So this ecosystem, I said, yes, this more than 100 plus patient has given me the content, the happiness. I want to now take it to a larger scale. Collaborate with medtech companies, collaborate with government bodies, take, mentorship advisors from, senior colleagues in this industry, and create an ecosystem. So we spread this awareness. I personally visit these clinics once in a while to spread the awareness of preventive cardiology. Well, again, that's the larger topic, where once we started a clinic, we want to ensure that we cover all the gamuts of, diagnosis to prevention to kind of education as well. So we have a roadmap of more than 250 rural clinics in the next few years I want to get in. And this Saurashtra Dhadkan project wanted to cover the entire Saurashtra's 10 districts with covering all the villages. I mean, so far I've been knowing. So with this project of pledging to keep the beating heart healthy and diagnosing earlier the problems and intervening in the golden hour is the commitment which I feel. And I feel doing so, I'm giving justice to whatever I, as a entrepreneur, as a cardiologist, and collaborating with tech companies, getting guidance from people, is going to create a larger contentment, and the people who are associated proud of this, that we deliver some justice to whatever domain expertise we have. Well, I mean, since these clinics are started, age of era of AI, IoT, whatnot, big data, telemedicine. So why don't we take this opportunity to kind of get this to these villages as well on a foundation work? So, educating people about, something very similar for a purpose and reaching out to kind of impact many lives. So, the last take-home message which I really want to, convey is creating a value-based, affordable healthcare delivery system, reaching last-mile cardiology. By doing so, I do for millions by saving at least those 100 lives I could, vouch and say, I aim to do even more with kind of resource which I would definitely, vouch for and get help from people around. And this is something which I'm really aiming to. And digital health, with the government's mission of Digital India, I'm sure this fits in their ecosystem of, getting this on. Since 2018, more than 50,000 patients I could really see and consult using the digital health approach. And I'm glad that, this has given me more contentment, and my team is really to kind of deliver more. And as we progress, need help from, government bodies to kind of, accelerate this, the dream, so that we jointly, and we jointly can put this in action, and we get that contentment support in ourselves. Thank you for giving me the opportunity.